Hello, I'm Dr. De La Paz here at Olean Dental Studio. Today I'm going to be talking very common questions that I get regarding clear aligners. A lot of people know it by Invisalign, but it's actually not only Invisalign, there are other companies that also make these type of appliances. And I'm going to be answering a few questions that I get asked a lot by patients. One of the questions that I get asked a lot is, what are clear aligners? Clear aligners are like invisible braces. They're made for your own teeth, and they're trays similar to this. And basically, they're placed on the top and the bottom teeth, and they get replaced every 10 days or 2 weeks until all the movements of the teeth have been achieved. And after that, we just have to wear retainers, which are similar, but they're only worn at night. So basically, clear aligners tend to give you a nice and beautiful smile, but you don't have to have metal in your mouth. It's made with clear material and it's removable, very cleansable, and very easy to get used to. Another question that I get is, does it hurt? Well, the answer is, it might a little bit be uncomfortable when you get them placed for the first few days because your teeth are not used to having that pushing on them. So you might experience a little bit of pain for the first few days, but it's not an unbearable type of pain. And it's something that your body will get used to. And as you replace the trays, they might be tight for the first couple of days, and then you just get used to it again. But it's how the process works. It's not a painful process, but yes, it has some sort of mild pain involved just for the couple of days. Another question that I get asked is this more expensive than regular braces? And the answer is, it depends where you go. It depends on the area. It depends whether you get it done on a general dentist office or if you go to a specialist. In our office, we charge about $4,200 for the whole treatment, where in my area, if you go to a specialist, you might be charged about $6,000. So there is a big price difference. I don't do braces, so I wouldn't be able to tell you how much would I charge for braces. But if you reach out to a specialist, they'll be able to tell you, I think it's about the same as braces, but I couldn't tell you for sure. One of the questions that people ask a lot is, are there any eating restrictions? Is there something that I cannot eat with them? And the answer to that is, you're supposed to be using those clear aligners for majority of the time during the day. So the day has 24 hours period. We want to be having those in the mouth for at least 22 hours. That leaves you a couple hours a day to eat. So basically, you just have them in your mouth. If you're going to eat something, whatever it is, it doesn't matter. You take them out, you eat and brush, and then put them back in. You're not supposed to leave it out and just spend hours without them in your mouth, because the idea is that they're working, they're making your teeth move. And in order for them to do that, they have to be in your mouth. So you can eat whatever you want as long as the aligners are outside of your mouth. Another question that I get, especially by parents, is that, can the teenagers wear this? And the answer is yes, they can. Now, as any other type of orthodontic treatment, not only aligners but also braces, teenagers need to be on top of oral hygiene, because that's an age when I see that a lot of teenagers don't brush or floss and kind of forget about that. And it's very crucial for the success of any treatment, especially clear aligners, that the teenager is aware that they now need to brush every time they eat before they put the aligners in place. They now need to floss more, because since you have those aligners holding your saliva underneath on top of your teeth, if you're not brushing and flossing, you can get more decay than you would if you didn't have them. So it's very important that oral hygiene becomes a priority, and then at that point, anybody can wear them. Another question that I get asked is, why would I do it with a dentist or a specialist if I can do it online for cheaper? The answer to that is, yes, you might be able to do it online for less money. However, you wouldn't have access to a specialized attention. You wouldn't have access to a customized attention as well, because when you do something online, and if something arises or you have a cavity or a tooth is not being moved the right way, where do you go then? I've had a few patients come over to our practice to get evaluated after they have done their treatment online, and it's very sad to see what happens there. There are a lot of issues that go on that could have been avoided by going to someone that knows how to do this type of treatment, either a general dentist that is trained or an orthodontist who is the specialist in orthodontic treatment, movement of teeth. So in order to get better results and end up with your oral health being excellent, and at the same time making you feel better about not only your oral health but your overall health, just don't try to save a couple dollars. Go to someone that knows what they're doing, and you're gonna avoid issues moving forward. So if you guys have any more questions, just reach out at 941-629-3200. Here at Olean Dental, we're very happy to help anybody in need. And bye.